My name is Lisa Connors. I'm with the Office of Public Affairs, and I'm here with Dean Klein, who's our director for the Office to Prevent and End Homelessness. And joining us shortly will be Carrie Wilson, who is the CEO of Cornerstones. We're here today at the Embry-Rucker shelter to tell you about the results from our 2017 point-in-time count. And Dean, can you tell us what the before we go into the results,
Sure.
a little bit about what the point-in-time count is?
Sure, I'd be happy to. The
Yes.
point-in-time count is a collaboration within the DC metro area as well as the Commonwealth of Virginia. So our point-in-time count for our community, for the Fairfax Falls Church community, occurred on January 25th of this year, 2017. And we did that in consistent with the HUD guidelines, which means that we counted people who were literally homeless in our community. Individuals who were at homeless shelters or time-limited transitional housing programs, or those who were unsheltered in our wooded areas, or those who were living on the streets. And so our point-in-time count on January 25th counted 964 individuals. And so that was the first time that we've counted in our point-in-time count under 1,000 individuals.
Which is amazing. That's a huge achievement, right?
It is, and it really is due to a tremendous collaboration in our community between nonprofits, faith communities, and businesses. And so that count included 474 people who were in homeless families and 490 single adults. And so that is way too many individuals who are homeless in our community. And so although we're excited, we recognize the importance of us continuing to really stay at it and stay focused. Along with the reduction of 9% from the previous year of 1,059, we also wanted to share that that means that we've reduced our homeless family population by over 50% since we started in 2008.
Right.
So although, again, we're very excited about that, we have many, many homeless families in our community, including at the Embry-Rucker shelter here, who need our assistance, and we're remaining focused on that.
Great, and I understand for the families, about 286 of our families included children.
Yes.
So that's still, we've come a long way, but that's still 286 children is still too many.
Exactly.
But anyway, getting back to this great achievement and what happened with the point-in-time count is, how were these milestones achieved? I mean, you've almost had homeless in half, the numbers in half of what they were 2008, and what does it take to make something like that happen?
Well, it really started with a plan. It was endorsed by our board of supervisors and hundreds of key stakeholders, nonprofit, faith, and business leaders that recognized we needed to do things differently.
Right.
And so we've brought forth very progressive and innovative strategies that are proven in other communities to bear in our community. And one of those really at the core is a housing first approach that we started off in 2009 with maybe one organization adopting that. Now we have an entire system that believes in that has adopted that, and is really consistently applying the policies and procedures necessary to house people quickly, to implement prevention strategies that really work, to really engage the community in different ways than before. In addition, we've really been focused on landlords, and so we've encouraged more landlords to get involved. We found creative ways to keep people focused on housing individuals that are hard to serve, that have high barriers, that are difficult to find housing for. And finally, we've developed and redesigned our entire homeless delivery system, and that really has allowed for more efficiencies, better use of local, state, and federal resources.
So we've had this amazing achievements, community working together, our nonprofit partners working together. Still some, a lot of work that needs to be done. We were talking about that, and I understand one of the big concerns is for our older population, adults who are 55 and older. Can you tell us a little bit about what those numbers are and who those folks are?
Yeah, if you can imagine being homeless and being over the age of 55, having lived most of your life and being at a point in time when you're maybe a little bit more isolated, in need of tremendous services, homeless, maybe unsheltered in our community. A variety of factors causes homelessness, but the reality of for someone who's older in age, it's really a huge issue for our community. When they end up at a homeless shelter in need of such significant support and resources. And so for a community, we really need to focus on this. It's a population that continues to increase. We're now at a third of our single population are over the age of 55 years of age. And many of them are way over 55 and still in need of housing and supportive services.
Okay. So we've had the count. What do you think is the biggest takeaway that our community should understand from what these numbers are, from the point in time count? What should we do?
I guess the first thing I would say is that we can prevent and end homelessness. There was a time in our community where people really didn't believe that. I think that our numbers now show with housing and with services and our community working together that we really can continue to reduce our numbers in our community.
Okay, great, thank you. Well, we're going to talk to Carrie Wilson now. Carrie, thanks for coming back. Again, we had some audio difficulties with our last try at this Facebook Live, so hopefully you can all hear us now. Carrie is the CEO for Cornerstones, and one of her facilities is here, Embry-Rucker Shelter. And Carrie, tell us a little bit about Cornerstones and what your role is with the shelter here.
Sure. Cornerstones has been working in this community for 47 years here in the community of Reston, and partnering with Fairfax County to operate the Embry-Rucker Community Shelter. This is a 30-year-old shelter, and really as we think about the snapshot in time that we just looked at in terms of the point in time, when I look here and think about what's going on there in the shelter, we're serving men, women, and children. So we serve both singles and families, up to 600 a year through the shelter.
Wow.
We also run a medical recovery unit for people who've been discharged from hospitals and nursing homes and have nowhere else to go, as well as meeting the needs of the unsheltered men and women who Dean is talking about, who have very high barriers to providing housing. We're able to give them a sense of normalcy, come in to do laundry, connect with a nurse or a counselor, just really get a hot meal while they look for work and housing.
Right, and I've heard amazing things about your programs here right next to the library. And just the other day at the Board of Supervisors meeting, they were talking about the reading program with the children, who are homeless here. And can you tell us a little bit about that?
It's just one of the wonderful things we do to really help the experience for kids when they're in a homeless shelter be less, and whether it's the reading volunteers or tutors from the schools that come out, we're doing a lot more, as Dean talked about, creative ways of working with our schools and the partner to help make this less hard on kids particularly.
Right. So, we're talking about kids. Now let's go over to what Dean talked about with our concerns about our older adults. During the count, we came up with 15 older adults who are between the ages of 70 and 88. Imagine being between 7 and 88 and being homeless. And 5 of those were unsheltered, but more, which blew me away, was that there was a 88-year-old who was counted on January 25th, and she was here at the Embry-Rucker Shelter. Can you tell us a little bit about this unique situation?
And it's as Dean described it, as you can imagine what it's like for someone. Tammy was increasingly in frail health. She couldn't afford, she had lost her family and had nowhere to stay. She ended up here somewhere she thought she would never be, and she needed nursing home care. We were very fortunate to be able to find a bed for her, but that is not the case for the majority of seniors. And I think we see, as Fairfax County's population is aging overall, meeting the needs of our seniors and people as they're aging is critical, as well as looking at our families, people who come here because they were driven either by poverty, domestic violence, or people who just can't find work that sustains their housing. We have to look at each person individually, and with our case managers and housing locators, kind of figure out what's the best solution for them.
Awesome. Thank you very much. And you all are doing amazing work here. We're getting great results from our partnership. Still have a lot of challenges and a lot of challenges on the horizon. Can you explain a little bit about, from your viewpoint, what the challenges are as we move forward in still trying to prevent homelessness and also to continue to bring down our numbers?
Exactly, because I think our goal is, as we've changed from the old model of 3 hots and a cot, we're not just managing homelessness. Our partnership here in Fairfax County, all of us have made that commitment to truly end homelessness. And so we're doing a lot of things very well, being very strategic and thinking about how we offer services. But probably the greatest concern is when you're living in an area where the cost of living is so high,
Absolutely.
when there's an inadequate supply of housing. Everything we've been able to do to drive those numbers down and move people into homes of their own is at risk right now as we look at federal budget cuts that are very real, and programs that are critical to not just helping us build new housing so that when this shelter is rebuilt, we'll build apartments for those senior citizens or for single men and women, but also the subsidies and services that allow people to go home and address their needs.
Thank you so much. Wanted to bring Dean back for a minute, and we want to, the point in time count results are available online now. Please go and take a look. We think you'll be surprised at some of the things that you might see. It's very interesting information, some of it people might not be expecting to see in Fairfax County. You can find that information if you go to fairfaxcounty.gov online and do a search for 2017 point in time count. Also, we'll have information available to you on our news center site, and that's at fairfaxcounty.gov/news. Wanted to tell you before we leave about something really cool that's going on, is that we are working on a project with George Mason University students and on a survey of the county's perceptions and actually experiences also with our homeless community. So you're on Facebook now. If you're watching this, please go to the county's Facebook page and scroll down and you'll come across the survey. We ask is that you take a few minutes and please tell us what you think. It's really important that we have a good idea of what the general public is thinking so we can provide you with the best information and also to know what we need to do to help our homeless community. Again, that's on that's a survey that's on the Facebook page and on the county's Facebook page, I'm sorry, and that is available to take until April 8th. You'll also be helping George Mason students with a class project, so you know, it's for the better good. We want them to get an A. And so thank you very much for watching. Thank you for your patience as we do this second round of Facebook Live. We hope that you've learned a lot of important information about our homeless community. Before we go, anything you'd like to say to?
No, I just would say get involved. Find a way that you can make meaningful impact with a population that really needs your assistance. There are many high-performing organizations in the community, including Cornerstones, that could be really a great place for you to volunteer, for you to donate resources, or for you to advocate for what you think is really important in our community.
Okay, great. Thank you very much. Thank you for watching Facebook Live on this gorgeous April day. And we'll be coming back to you again in May with information about the survey results from George Mason students. And have a great day. Thanks.
Thank you.